Perfect. So Dr. Wang is going to speak to us for about 15 minutes, and then we will fill the rest of the time with a wonderful conversation. So over to you, Matt.
Okay. First of all, good evening, good morning, and for the people from all over the world. I'm connecting through the internet from China. The connection may go off, as you know, but Maxine said when I try to reconnect, she's going to sing everybody a song. Okay, so I just sold you out, Maxine.
Oh no, no,
okay.
No. I really hope your internet holds up for everyone's sake.
I hope so too. I hope so too. So let me first start sharing a screen. Okay, can you see my screen?
Yeah.
Maximum? Okay, good.
Yep.
Just tell me. Okay. All right. The title of my talk is about air rescue. It's quote unquote, WeDoctor platform to help the global fight against COVID-19. I'm Matt Wang, CEO of WeDoctor International, and I'm a former IBM Global Vice President. So WeDoctor is an online platform in China for digital health. Let me just rewind the clock back to January 23rd, when the day Wuhan city was locked down. It was announced in the early morning, and on that day, so the entire city was locked down. It's the first time happening in China, and everybody is very anxious, very, very anxious. You probably heard about this through the news broadcast and what's going on in Wuhan, etc. But later, everybody know that the government organized over 50,000 doctors and physicians all over the nation to send to that city because they don't want the healthcare system to be overrun by the patients going into the hospital. Now, not many people know about this. On the internet, there are over 57,000 doctors. We call them white angels, voluntarily working on the internet hospital to save the lives in Wuhan and across the nation. As you know that many of those people who live in Wuhan may not get COVID-19, but they can get normal sickness. But they don't know if they should go to the hospital or not. And on January 26th, the number of visits is more than 11 million, okay, reached to 11 million a day. So you know that without this system, the normal offline physical hospital will be overrun by the patients going there. Many of them, they just want to ask a question. They're normally not getting the COVID-19. They have normal sickness, right? But they don't know if they should go out or not, right? And this shows that how important the online digital healthcare system is working. Let me go to the next page, which is there are two phases of WeDoctor Air Rescue. The number one is domestic, and the second one is global air rescue. During the domestic time, we have to solve a problem, okay, which is online purchasing the medicines. We solved the problem of delivering the medicine online, and also for the 400,000 patients with chronic illness. As you know that the chronic patients, that they actually have to refill their prescription every 2 weeks to 4 weeks. And because of the lockdown, and nobody actually want to get out on the street or go to visit the hospital, they have to depend on the online digital health system, which is the WeDoctor system, to do the free diagnosis, to get find a doctor, to get the electronic prescription filled, and do the online purchasing of the medicine, and also get the insurance to pay for those medicines, and then through home delivery service to send those medicine home. Very, very important step. And originally, not all the online hospital has the permission from the insurance company, medical insurance company, actually to directly for the payment. Now, this is crucial because people cannot go out to pay for themselves. It has to be all electronically, okay? So we worked very fast working with the social insurance. Most of the people in China are using government-run social insurance. And so the social insurance system has to be connected with WeDoctor and many of the online, hospitals. And you can see on this page that even the normal delivery service is closed down. And the volunteers has to pick up those medicine and go through door and door to deliver this. So every single phase, every single cycle, you can see many of the volunteers and risking their own life to do so, okay? Now, the second phase, China has launched the WeDoctor GCPC, and along with Ali Health and Baidu, etc., to help the people outside of China. As China has contained the COVID-19, we can see that it is happening in global. And we want to quickly launch the platform, the global platform, so that we can share the experience that we have gained by fighting the COVID-19 domestically for the international patients. As you know that in order to organize such things, not only language is one barrier, but also the legal things, right? You cannot do medical practice in other countries, even though you have doctors online in China. Okay, we quickly organized 6,000 doctors who has the experience fighting COVID-19, and also have practice in Wuhan to get online. And these doctors have to be able to speak English reasonably good, right? Reasonably well. And we also get the recommendation from the embassy to 176 countries. And then we quickly online the multi-language support. The first language is Italian. We find a lot of requests from Italy, and many of the patients from Italy get online to do the consultation, and they want the local language. Of course, English is the default one, and then we have the French, and go on with 5 main languages there. And then it's not enough. A lot of countries request that the system to be in their local language. So we quickly launched the translation engine on that app, and people can do the consultation through the machine translation. Even though its machine language is not that good, but still the doctors can use English and other 5 languages to do the communication along with the machine translation. Now, this is something that we did not expect. We launched the WeDoctor Global Consultation and Prevention Platform originally just for the patients, right? The normal people who want a consultation and want to find out what's going on. But quickly, we've got requests from a doctor called Luca from Italy. And he learned about this story and saying that, hey, I'm not a patient, I'm a physician. Can the system connect me with Chinese doctors and to do the experience sharing with us? And so that we can fight COVID-19 better. Because we want to protect ourselves, we want to do the best service for our patients, etc. So we actually opened a platform for the doctor-to-doctor seminar and experience sharing. And then later on, North America, Germany, India, Thailand, and even go to Africa through the UN. Okay, they organize these sessions, and it goes on and on. And there are sessions that sometimes over 10,000 doctors together and doing the experience sharing, which is fascinating. And I see the global collaboration among all the white angels, okay, the doctors together. Maxine, can you hear me?
All good, don't worry.
Hello?
We can hear you perfectly well. You're definitely still live, not to worry.
Okay, okay. Then the next thing happened is also quite, we did not expect, okay. So when we did all these doctor-to-doctor experience sharing, etc., and we got the request from the healthcare providers saying that now we have the experience, we know what to do, but we don't have any of the medical mask, we don't have the protection gear, we don't have PPE, and we don't have all these, ventilators and etc. Even the testing kits. Okay, now you have the experience fighting COVID-19 in China. Can you actually sourcing those materials for us? Now, this is not what we expect. We thought this is a platform to connecting doctor with patients, doctor to doctor, experience sharing, etc. And suddenly we have to be a e-commerce platform, but we don't have the experience of sourcing the medical devices, right? And they have to be CE or FDA or CFDA's approval, and et cetera, which is not in our forte, and we don't know how to do this. But we certainly can do some donation. This is a donation about 1 million medical masks, okay? But we connect the manufacturers with the healthcare providers abroad, okay? We did quite a bit of connections. And so you can see that this is something that really, out of many people volunteered their time to do these things to get together. We don't, at the very beginning, we don't know how to start. And then quickly somebody mentioned that, hey, we can go to the hospitals in China, go to the doctors, and they have the experience where those hospitals sourcing those material from, which manufacturer in China, right? And then we rated those the equipment providers, okay, and then go through their certification, etc., and send samples to abroad, etc., and connecting these people together, basically with a free service, right? Now. Later on, we're facing another challenge about logistics, because this is not our, it's not, what we do at best, right? The flights get canceled, and sometimes the shipment will be stored in or compensated by some other countries. Okay, it's not in the destination, etc. And sometimes the entire country get locked down, and we don't know how to reach that. And we work with the healthcare providers outside China, think about every single way how we can do this. Okay, and there are many stories about this, and which I think only when in crisis that you can see the real character of the people. So as a summary, online health care services have become an important force behind the public health emergency of international concern. Many countries' governments actually realize that, and now we, from our statistics, we can show how important the WeDoctor platform has performed, fighting against COVID-19. Right, on this site, there are over 153 million visits, right? 57,000 doctors volunteer their time, and they have done over 2 million free consultations, okay? And it's free of charge, right? And also, there are many people who just want the psychological assessment, right? And we have many of the menus published there and get many downloads, right? Over 778,000 downloads, right? And we cover the service covered more than 220 countries. Maxine, are you still there?
Yep, very much still there.
Okay, great. So COVID-19 epidemic is a crisis as well as an opportunity. It's all quote unquote, okay. Through this event, there are quite a bit of a policy breakthrough. I'm quite sure it happened in China and happened in many other countries as well. Second, user habit development. People are now accepting this, as a way of getting healthcare services. And also through this, we build a closed loop, service online. Originally, you cannot receive insurance payment. You can have the electronic payment, like a Visa card and credit card payment, or a bank draft, etc., to pay for it. Now the insurance actually get connected. That's more convenient now. And the internet hospital becomes the norm, okay? So not only the user habits, but the medical doctor behavior, also they're getting used to that too. And the drug distribution and the hospital managers also think this is a way that can add on to their physical hospital, service, providing a service there. And the government also treat this as a serious platform to do, healthcare. And then because of COVID-19, since people have developed such a habit, they later on are sticking with that. It's a little bit stickiness, and they get online visits and getting the medicine online. And people also have signed up family doctor services online. We have a better chronic disease health management. And also the hospital getting connected with each other. Originally, not with the internet hospital, that it's difficult to transfer the electronic records from hospital to another hospital. And the offline, a lot of offline health services become online services, and the online service become a closed loop process. It's a true O2O, okay? So you can see the internet hospital is linking the physical and digital world together. Now, it is a multi-trillion-dollar industry, right? Globally, you have $4.7 trillion for the medical service industry, and 2.2 trillion the pharmaceutical and equipment industry, and 1.8 trillion basic medical insurance business, and also 0.5 trillion commercial health insurance, etc. So it is truly connecting the doctor with patients, with the drugstores, with the insurance company, with the logistic companies, and getting it as a closed loop together. Now, there is one thing is happening, and not many people notice that. The hospital system, physical ones, right? When patients go there, it's a transaction. When you're sick, you go there, and the doctor give you a prescription, take the medicine, go home and take the medicine and get well, right? It's a by transaction. But with internet hospital, a membership get established. So even before you get sickness, or you're healthy, the system knows about you. Okay, they can manage your health as a life cycle, as a full cycle. Now we're treating each individual as a holistic, holistic system. Okay, not treating you as a transaction. Okay, So even you are healthy, we will provide you the health advice. So the system knows about you. The internet system actually inside hospital knows about you. So it's truly, instead of it's a healthcare provider, it's become a health management provider. Okay. So as you know that there are many digital health platforms in the world, and WeDoctor is luckily to be ranked as a top one in a global leading data think tank, CB Insights, among 150 digital health enterprise globally, and top 30 in the America's most influential business media, which is Business Insider. Okay, the world's top 30 most valuable technology company, and we are very happy to be in that position. Now, people know SaaS in China actually generated a big industry called e-commerce, and Alibaba emerged as the winner there. COVID-19 will drive the digital health industry up quickly, and hopefully WeDoctor can perform very well in this field. And in WeDoctor, we believe in better health, better care. Thank you.
Perfect. Thank you so much, Matt, for a really comprehensive overview about what the last couple of months have been for you at WeDoctor. My partner is also involved in digital health as well, so being on the receiving end, it's been quite hectic for everyone involved in seeing how that's all exploded for everyone. So unfortunately, we don't have enough time to do a Q&A, but actually, to be honest, your presentation covered a lot of the topics I was kind of really keen to understand about. So the international scaling, how you kind of navigate different jurisdictions, some of the logistical and language difficulties in that scaling. And there are some very, very impressive numbers coming out of WeDoctor. And though we have an international audience, we have many people from the UK, and so seeing those sorts of numbers in comparison to the sorts of numbers we usually see is really quite impressive. So thank you so much for joining us. If people have further questions about some of the things that you presented, there are other kind of forums to have discussions on via CogX, so please do continue the conversation. And in some respects, I was so worried that you were going to drop off again. I also found some pretty good resources around COVID limericks. So if you do hashtag COVID limerick, you found some quite creative people on Twitter apparently. So now we're breaking for lunch. So enjoy the little break. You know, there's lots of other sessions happening in CogX, and just a final huge thanks to Dr. Matt Wang from WeDoctor.
Thank you, Maxine. Goodbye, everyone.
Want access to more CogX videos? Subscribe now for free at cogx.co.